How's it going, guys? Past level question pathology, steps 1 and 2. Some of you have no idea what the normal lab values are. It doesn't actually matter per se, because you can look at how they change with these actions here in the question and infer what the pathology might be and eliminate to get there. This is what the NBME does. Okay, but I will tell you that 275 to 295 is the normal range for serum osmolality. Urine osmolality can be as dilute as 50 all the way to 1200 hyperconcentrated. Okay, so this just gives you an idea of where we're at, and glucose should be 72 to 99 fasting. So what's most likely to be seen as patient? Choice A, adrenal cortical insufficiency, wrong fucking answer. This is to eliminate students who don't know the difference between aldosterone and ADH, the latter vasopressin. You look at the labs here with these actions, clearly it's an ADH vasopressin type of question. It's a long discussion. If you have idiopathic autoimmune hypoadrenalism, that would be Addison, and you'd have low sodium, high potassium, low bicarb, low pH. If you had Waterhouse-Friderichsen, meningococcal septicemia causing bilateral hemorrhagic necrosis of the adrenal glands, same deal. Wrong fucking answer. Choice B, auditory hallucinations, wrong fucking answer. Some of you very confused as to how these even relate. Psychogenic polydipsia, patients trying to free themselves from the spirits, very buzzy descriptor, right? And they're drinking too much water. So you'd have low serum osmolality and low urine osmolality. Both would be low. Okay, so I told you don't need to know the normal ranges per se, but we can clearly, and as I'll talk about, you can see that when desmopressin was given, that osmolality increased, and we can infer that something else is going on here, okay? Wrong fucking answer. Choice C, bipolar disorder, wrong fucking answer. Lithium, first line, causes nephrogenic diabetes insipidus. So 275 to 295, normal range for serum osmolality. So we have concentrated serum here. Well, that is what we would expect for diabetes insipidus. Okay, so that is consistent. Even if you didn't know the normal ranges, you can see desmopressin worked. Now, desmopressin won't work. It's an analog of vasopressin. It won't work with nephrogenic DI because we have insensitivity at the kidney to desmopressin. Now, some of you say, well, how do we know how much it's supposed to work? Doesn't fucking matter. The point is it worked. At least a 50%, 60% increase. Okay, so if the USMLE is trying to insinuate that desmopressin didn't work, then maybe they would say 200 again, or they'd say 210, which is basically nothing. Wrong fucking answer. Choice D, meningitis. Correct answer. So some of you are going to get emotional right now. Now let's just be straight. Meningitis, head trauma, such as gunshot wound to the head, they can cause either SIADH or central DI. They can cause either. This is central DI because we have concentrated serum and desmopressin worked. So we have paucity, we have a deficiency of production / secretion of endogenous vasopressin. USMLE can give you the same question. They'll ask you the structure that's messed up, kidney, etc. The answer will be hypothalamus. Vasopressin produced in the hypothalamus, stored in the posterior pituitary. Okay, so this is central DI. And even if you're not 100% sure still, we can just continue eliminating. So let's just look at the others. So oat cell lung carcinoma means small cell bronchogenic carcinoma, wrong fucking answer. This would cause SIADH. I decided to be a flagrant asshole because when some students don't know what's going on, they choose weird sounding shit. And they probably think, well, he's trying to obfuscate and mask the diagnosis here as oat cell. He's trying to be creative. So maybe that's what the answer is. Wrong fucking answer, okay? If we had SIADH, we'd have dilute serum osmolality. Okay, so you'd have concentrated urine to start. This would be a lot higher. Okay, 800, etc. We're talking most questions Okay, 1 out of 15 times, okay, you can see it down in this range, but you'd have concentrated urine to start, and you'd have dilute serum osmolality. Wrong fucking answer. Choice F. And also, because your ADH level would be super high, if you administered additional exogenous analog, it's not going to make a difference in the setting of SIADH. Choice F, recent viral illness, wrong fucking answer. I mean, I don't really know what to tell you. I threw glucose in here as if it's diabetes mellitus related, because that could relate to DM type 1, right, where you have viral illness, but our glucose is in the normal range. So 72.99 fasting normal, 100 to 125. Impaired fasting glucose, 2 measurements fasting 126 or greater DM, any 1 random glucose 200 or greater DM, HbA1c 6.5% greater DM. Wrong fucking answer. You know the deal. Two man content like Mr. Appreciate your time. That's it.